Hi, my name is Marinus de Kleuver. I'm a spine surgeon from the Netherlands, and I'm here to talk to you about adult spinal deformity, otherwise known as adult scoliosis. Scoliosis is a curvature of the spine, and in adults there are many causes of scoliosis. Two common types are what's called idiopathic scoliosis that occurs in childhood and presents with symptoms in adults, and another type is called the adult degenerative scoliosis, which is degeneration of the spine that occurs in adults who originally had a normal spine. Adult idiopathic scoliosis is a curvature of the spine caused by a process that we don't quite understand. Idiopathic scoliosis occurs in childhood. It usually becomes visible in adolescence as children grow, and it can present with some curvature of the spine, some asymmetry of the chest and shoulders. And very often there are no symptoms, no complaints, no pain. As people get older, the bigger curves can sometimes progress into adulthood and become more significant and more visible and cause complaints. And once they start causing complaints in adulthood, we refer to it as adult idiopathic scoliosis. These curves can be in the lower back, but they can also be at the higher level between the shoulder blades. The symptoms of adult idiopathic scoliosis are often low back pain, but it can also be that due to some of the wear and tear in the lower back, that degeneration causes pinching of the nerves. And pinching of the nerves or compression of the nerves in the lower back can cause pain radiating to the legs. Apart from these symptoms, patients who have an idiopathic scoliosis with symptoms in adulthood can suffer from some fatigue and problems in long axial loading. And what we mean by axial loading is standing for a long time or sitting for a long time. Adult degenerative scoliosis is another type of scoliosis. This is a curvature of the spine that occurs in adults, but these adults originally had a normal spine. It's usually a sign of degeneration. Just like in any other joint, the hip or knee, you can get degeneration, and we call it osteoarthritis. This leads to degeneration of the cartilage, and between the vertebrae or the vertebral bodies, there's a cushion of cartilage that helps the spine absorb shock. And these shock absorbers, they can lose their flexibility, they can shrink, and as they shrink, the spine can then also change its form and develop a curvature. Part of that curvature can be leaning forward a little bit, but it can also be a sideways curvature. And the sideways curvature is what we would call an adult degenerative de novo scoliosis. This type of curvature is slightly different to the other type, the idiopathic type, because it tends to occur at a later age. Idiopathic scoliosis already occurs in childhood and can present symptoms in an adult, but the degenerative scoliosis type really develops completely new in the adult and usually above the age of 50. The symptoms of adult degenerative scoliosis are somewhat similar to the symptoms of adult idiopathic scoliosis. Almost all people who really have problems with this type of curvature have low back pain. Low back pain is the predominant symptom. And just as in the idiopathic scoliosis, because of the pinching of the nerves that can occur, leg pain can also be a symptom. And this leg pain can be in one leg or both legs, and it can really hamper people in walking, creating stiff and painful legs and reduced walking ability. And not just that, as the discs and the cushions in the back degenerate and lose their height, most people become somewhat stooped and lean forward, and this creates fatigue and tiredness.